guys, welcome to my channel. This is Dr. Shreya and I am a physiotherapist. So today I am going to break the myths that usually we come across as a physiotherapist. Myth number 1. Physiotherapy is only used for injury recovery. No, physiotherapy is not only used for injury recovery but it is also used for injury prevention. Now what exactly is injury prevention? If a person or a patient has been repeatedly doing certain activities for a longer while, he is prone to certain kind of injury. Okay, for example, if an athlete who has been sprinting for few years now without any pre-rehabilitation of that athlete, this person is more prone to shin splints and hamstring strains or per se any other condition majorly seen in athletes than the other athletes who have been training well for their sports performance. Or take other case, if you take a case of a coolie who has been lifting lot of weights every time for few years now, so he has been more prone to back injuries as compared to others. So what we do is we train their back muscles, we train their core muscles, we train their lower limb muscles so that we prevent the back injury that is going to happen in next few years. Myth number 2. You need a doctor's referral for physiotherapy. No, you can directly walk into the clinic and get yourself assessed and treated, or in fact directed to the proper healthcare team. For example, if the patient comes to me with backache, but I have assessed him, I have tried various tests, special tests, I have examined that patient properly, but still it seems a little off. So maybe that backache have occurred because of some kidney issues. So I direct them to a urologist. So that is how we do. So you can directly come visit a physiotherapy clinic. If I have neck pain, you don't have to go visit an ortho, take medications, then come to a physiotherapist. You can directly come to us. Backache can directly come to us. Any kind of aches, any kind of asymmetry you feel, any kind of muscle imbalances, any injury, any acute chronic injuries, you are definitely ought to come to a physiotherapy clinic directly. Myth number 3. Pain means something is torn or something major is happening. No, pain means it can be simply because of certain weakness or tightness in a muscle. So tightness basically means just like you see my hair. So if I put my hand, it will have knots in it. So similarly, if the muscles are not used properly or is not optimally fired, your muscles tend to create knots in between them. These are called trigger points. So when we actually palpate those muscles, I mean when you actually touch those muscles is the time when you understand, okay, so this person is having pain, that can be because of this reason. So pain is actually for us as a physical therapist is a good indication to treat you properly, to identify the root cause. Pain literally helps us a lot. Myth number 4. Physiotherapy is same for everyone. Excuse me, physiotherapy is not same for everyone. It is custom made, tailor made to your specific needs. If I see 100 low back pain patients, 100 low back pain patients will have 100 different root cause, 100 different goals, 100 different aids. The specific needs, the specific goals, the specific cause of this XYZ low back pain patient or any other per se musculoskeletal related patient is different. So we treat the patient differently and we custom make the protocol for that particular patient. It is not one protocol for every condition. You treat the patient, not the condition. Myth number 5. I did physiotherapy once, but it didn't work for me. Wait, I did physiotherapy once? One session is enough to treat or fix your these many years of problem? Someone who comes to me with a knee pain, and this lady is around 60-year-old and has been terribly having knee pain since 10 years, and she expects me to treat her in 1 or 2 sessions. That is practically impossible, because we have to go dive into your deep cause and treat and strengthen your muscles and improve the mobility, improve the joint lubrication. So this thing is going to take time. You expect result in 1 session or 2 sessions or just few sessions? No, because healing with physiotherapy needs consistency, and the person or the patient should be determined enough to work throughout the recovery process. It's not always 1 session and मैं ठीक हो गई या मैं ठीक हो गया. So let me know in the comments which of the myths did you believe and have been broken now, and share and subscribe my channel.